are going to help get through life and also through the situations that come and that revolves around our families and also our health. And so today also we get to have such a moment as that, as we get to talk about the dangers of over-the-counter medication. Someone might be asking me what that means. Naona venye unaumwa na kichwa unakimbia hapo kwa pharmacist ama hapo kwa karibu duka la dawa. Let me use yenye itaeleweka, duka la dawa. Nasikia kichwa nipe mara moja, ama unaenda hata kwa duka general shop and just take the medication. We want to understand what are the dangers of that, because I believe kuna dangers hapo. I hope you're ready to learn. Also, we'll be talking in-depthly about matters mental health and also how it also gets to be affected by that. And today we have in studio Winfred Waigumo. I hope I've said it right. Mutahi, who is a pharmaceutical technologist. Umesikia hiyo jina? Yeah. From Nakuru Teaching and Referral Hospital. She'll be here to guide us through that and also help us understand that. Remember, you can connect with us across all our social media platforms on Facebook and YouTube, and the number on your screen. If you have any question, feel free to ask. We'll be here to answer it. Karibu tusemezane. Good morning, Daktari.
Good morning, Emily.
How are you?
I'm good.
Yes, I'm also well. Yes. I also saw the how are you doing coming.
Yeah.
You look good.
Thank you.
Karibu sana to Mizpah.
Asante.
Yes.
Yeah.
So, jina ngumu is zile when we were in school, in high school, when we listen, what do you want to become? You go looking for the toughest. The toughest yenye itashtua. Vijiji na kijiji, but what does it actually mean, even before we go to our discussion?
Okay, good morning, viewers.
Yes.
Pharmaceutical technologies. When you hear about the word pharmacy, it tells about drugs.
Oh,
mambo na madawa.
Okay.
So when you see someone is a pharmaceutical technologist, ameenda shule, amefanya a diploma in pharmacy for 3 years, and is able to train, is able to dispense, is able to treat some of the diseases.
Okay.
Yeah.
3 years was to ask the duration.
Yeah.
Okay.
Yeah.
So lazima diploma. At least go mefanya diploma.
Yes.
Okay.
And you have to be registered by the Pharmacy and Poisons Board.
Okay.
That's the board that regulates pharmacy.
Okay. So kitungumu sana. No, as people may just be scared due to the name. And what are some of the qualifications for you to study for that course?
Okay, for you to do pharmacy, you have to be so good in sciences. You have to be good in mathematics.
Yes.
One language, either English or Kiswahili. Yes. You have to do chemistry, biology. You have to have passed those sciences. You have to have a C and above.
In all them?
All of them.
Okay.
Yeah.
So I know there are people who are still, they just completed their high school studies, and that's a good opportunity for them. Yeah. And now to our discussion of today. We're here to talk matters, the dangers of over-the-counter medication. And mtu anaweza kuwa anashangai milioni over the do what now? Help us understand, what do we mean by that?
Over-the-counter drugs are the drugs that are easily accessible. They don't need a prescription. You just go to the pharmacy and tell the doctor, give me this painkiller, this syrup, this drug. As in, it's just easily accessible to the pharmacy without going to the doctor.
And I've heard you saying, give me this. So niwe unajifanya daktari.
Yeah.
In short.
In short, wewe ndio unajiprescribe, because you don't even inquire, what can I use for headache? You just go, nipe paracetamol, nipe mara. You're the one who is prescribing for yourself.
Okay.
Yeah.
And today we'll be talking about the dangers of that.
Yeah.
But even before that, why do, okay, the question might seem like easy to answer, but basically, why should people, number one, to those people who are going, definitely they are sick. That's one of the reasons. But sana sana nini huwa inafanya watu waende wana choose over the counter badala ya kwenda hospitali?
For one, over-the-counter drugs, there are those people who are knowledgeable about the drugs. They know. I once took Maramoja and my headache went.
Okay.
I once took this cough syrup and the cough went. One, they are knowledgeable.
Okay.
Another thing, they were advised by other people.
Okay.
You have this problem. I also had the same problem and I used this and it went.
Yeah.
Another reason, people don't want to waste time in the doctor's queue. They just want to go and request for the drugs without further management.
Yes.
Which is wrong. At times, for those mild symptoms, it's okay. But for things that require attention, you have to see the doctor.
Okay.
Also in the pharmacies, without that self-request, you can go and tell the pharmacist who is in the counter, I have a headache, I've been having this kind of cough, what can I use? And they will advise you on what to use without you prescribing for yourself.
Okay.
If you are advised by the pharmacist about what to use, it's okay. But if you go self-medicating for yourself, that's where the problem comes.
Okay.
Yeah.
And now to the pharmacist. Kwa sababu pia yeye atauza hiyo dawa. No, I'm not throwing stones or anything, but also, why is it that if I come as Emily and I come to you, Winnie, and I'm like, nipe mara moja, you'll just take and give me what without even asking what the question. So what leads to that for you as the pharmacist?
As the pharmacist, we have several categories.
Okay.
Maybe there is a pharmacist who has been employed. He's there for sales.
Okay.
Others are there. Ni mara moja unataka. Maybe that person needs that mara moja because he has a headache. You go questioning and that dude just disappears. So at times, it's only when he comes again and again, you'll question, why do you use mara moja quite often? But if it's the first time, give me mara moja, surely maybe that person has a headache or something. But if it is persistent, you get concerned and you ask, why do you take mara moja all the time? You tell him of the side effects.
Okay.
Yeah.
Okay. Now coming to maybe I'm that person who has decided I will not prescribe the medication for myself, but I'll ask as we should ask. But now tell me, for the pharmacist, how far can they go when it comes to treatment? Should we classify them the same level as doctors? Can I just go to them and I tell them all my shidas and I am sure I am totally healed by the time I come from there? To what extent should I go talk with them?
Pharmacists are qualified doctors. Okay. Those who have done a degree, they are qualified doctors. Those who have done a diploma, they are also doctors. They know about the disease underlying. They know about what causes this kind of pains. They know the symptoms, they know the signs, they know everything.
Yes.
Now, where it reaches and you send someone to seek medical advice from a physician is when you gave this dude a medicine, he takes it for 3 days, 5 days, or according to the dosage that you advised him, but the disease didn't go.
Okay.
At that point, you tell him, no, go and see a physician for further tests. He might send you to the lab, he might send you for an x-ray, for a CT scan, for an MRI, depending on the severity of the disease.
Okay.
For example, headaches. Headaches are the most treated cause of the painkillers. You go to the doctor, I've been having a headache, give me mara moja. All the time you have a headache, give me mara moja, give me paracetamol, give me all those painkillers. They know all those painkillers. Others use them because they have some addiction. There are some painkillers with addiction properties. So that person feels good when they take that painkiller. Not bearing in mind, maybe there is something which is underlying. Maybe that person has hypertension. Maybe that person has a tumor. Maybe that person has kidney disease or something. So when they are persistent is when you're supposed to take note. For instance, there is this case of a girl who was in college. She used to have those headaches. So she used to have paracetamol in her bag. Every time the headache comes, she takes paracetamol. She took paracetamol for quite a long time. But what was behind the headache was a tumor. And it was too late, because the moment the eyes went, because kichwa iliuma sana,
hadi akakuwa blind.
Mpaka the eyes didn't. Because the tumor was growing and it's in the head.
Na yeye ana suppress na dawa.
So ana mask the pain, akidhania it's just the headache. So the tumor went on growing, ikafikia kwa the occipital nerve, macho zikaenda. So by the time she was being done a CT scan, it was too late. The tumor was so big, it couldn't be removed. Imagine she died, such a young soul at 21. And it's just because of self-medication.
So we'll be talking about in-depthly about the dangers. And I like it that you've given that example, because people sometimes wataka kusikia ubaya first hand. Huyu alifanyika hivi, you know. People don't easily believe just by words, you know. And now coming to, you've told me that if I go to a pharmacist, they can treat me. But now there's also this issue that I've had and also I've witnessed, where you find maybe a person was a cleaner in a hospital, and then akaendelea akaona maybe ana interact na madaktari 1 2 3, akasema job opportunity, nenda kufungua pharmacist, you know, mahali. And so how do I get to know the qualified pharmacist? Because wewe enda nikikuuliza umefanya degree, alafu nipe dawa sasa, you know. So how can I identify that as I am coming to you? Yes, I won't take over the drug, over the counter medication, but if I trust you with my issues, I am sure utanisaidia.
That's a good question. There are so many quacks. We don't refuse. But for a qualified pharmacist, they are registered by the Pharmacy and Poisons Board. And they have that big poster where there is a code you send to the Pharmacy and Poisons Board to see whether that pharmacy is registered. Most pharmacists have that board.
And it should be where they are.
It is well displayed in the front. So if you want to know a pharmacy is registered, you'll see that poster, Pharmacy and Poisons Board. Kindly send this code to, there is a number there, and that's how you come to know this is a pharmacy. This pharmacy is registered. But others, those which are not registered, they don't have that registration certificate. They don't have that poster. I'm so tempted to now, from now on, nikitumwa, the first thing I'll be checking for that. Because I believe it is, because I've had issues with people who maybe wamepewa over the counter. This people, that person is a quack. Na hata hataki kujua, umekuwa ukikuja hapo over and over again. Hataki kujua kama uko na shida, bora semeenda hapo ni business opportunity. So they go out, they exploit to find people are dying and all of that. And now if can there be what are they called? Can there be watu wanaweza kuwa, if you find that this person is not registered, kuna njia wenye watafikiwa, they can inaitwa nini? Prosecuted. Can they be prosecuted or anything? Should I report them? There is the regulation body. The Pharmacy and Poisons Board is a regulation body. They have inspectors who come around checking those pharmacies that are not registered, those which are operating with people who are not qualified.
Okay.
So when you find, even if you find those quacks, they are one in maybe 100. So not all pharmacies are quacks. Yes, because there is a regulation body. Not everybody can open a pharmacy. Because the moment you open a pharmacy, every county has its own regulation body. They'll know in a certain place was opened a chemist. I have to go and check whether that chemist followed the rules. Before you open, you have to follow procedures. They have to come for inspection and see whether that place is good, it has water, it has ventilation, whether the drugs are well arranged. They have to inspect before you open.
Okay.
You just don't wake up and just open a pharmacy.
Yeah. Watu wanasema Kenya kumeanza kuwa kubaya. Fungue biashara. And now what about cleanliness? Because there's some places you can go and you find there are issues with that. Unaenda unaambiwa nipate hapo nyuma, but ukienda unapata syringe and all things are there. Allow me leo niwaanike tu pole, but we need to help our people.
Most pharmacies, we are not supposed even to inject. So when you go and see someone wants to inject you, we are not allowed.
Hey.
Clinics are those places that you go for injections.
Not a chemist.
Not in a chemist. A chemist has to be so clean. Even the display has to be smart. You go behind there, the dispensing area, it has to be clean. You're not supposed to go meet gloves, syringes,
madamu.
Okay. No, the one who is operating that is doing it illegally. A clinic is what is supposed to be having such things.
Wow. Okay.
Yeah.
Please, now that leads to the next question, the illegalities of it. You know, what should not be done in a chemist? No one, you umesema kusikwe na injection.
Yeah.
Other things?
Though they are introducing injections, the injections they are introducing maybe family planning or maybe start doses.
Okay.
Because maybe someone came, amefunga na kifua.
Yes.
There is a first aid you can do. You can inject her before for referral. Such emergencies, but not every patient akikuja ingia nyuma ni kudunge
Kuna dawa ya kukuponya haraka.
It's not supposed to be that way.
Okay.
Yeah.
Is there any other thing that they should not do that we should know?
That's the major one.
That's the major
Injections. We are not allowed to do it in the chemists.
In the chemist. Watu waende hospitali.
Kama ni shindano, enda hospitali. Kama ni hiyo family planning, go to the hospital. You need to be taken your BPs. You need to be taken your temperature. All those things that are supposed to be taken before, prior the injection.
Yeah.
You know, you can inject someone at family planning. Injection. Na huyo mtu akona pressure. You didn't take the pressures. Umlete shida. Huku mpima weight. As in there are some things you didn't follow. And that's why we have hospitals. And in the hospital we have family planning department. We have people who specialize with diabetes, hypertension. As in each disease has its own consultancy. Yeah.
So we should be wise on that.
Yeah, we should be wise on that.
Okay.
Juu unaweza enda pale udungwe vibaya.
Yeah.
Who will you blame? Who will you sue? Mimi nitajiondoa. Nisema no. Here we don't do injections. And it's true, in a pharmacy you don't do injections.
Urukwe wanini?
Utarukwa.
Kwa peke yako. Utasema ni nani huyo alikuinject kama si yeye. Where I think this is important because so many of us, we are having issues and we are just doing it. The thing is we are doing it wrong and we are doing it in the wrong way. Now when we come back, we'll be telling us about the dangers of that because I know there are many, many dangers, plus also the mental well-being. Also we'll be mentioning about that. So stay with us, stay tuned. Remember, this is Family and Health Thursday and we are having one of the people who can help us to avoid, and hata kama si avoid kabisa, to reduce on the over-the-counter medication. Go to the hospital. My hospital says anymore. There's private, there's also public, and so it is very important that you know what you are struggling with. Allow us to take that break, but when we come back, we continue.
Mizpah TV, keeping the fire of the altar burning.